So I'll be talking about pulmonary stenosis. It is a cyanotic heart disease where means there is no right to left shunt. So coming to the anatomical diagram, this is the 2D diagram of the heart, where the right atrium will receive blood from inferior vena cava and superior vena cava, and will flow into the right ventricle through tricuspid valve, and from right ventricle it's supposed to it's supposed to go to the lung via the pulmonary artery. It will be divided into the left and right pulmonary artery. So what happens in this pulmonary stenosis is that there will be usually the pulmonary artery valve is consists of tricuspid valve, but sometimes it can undergo fusion, and sometimes it is bicuspid instead of tricuspid. So this can cause a narrowing at the pulmonary valve at the level that causes resistance to the flow of the blood from the right ventricle to the pulmonary artery. So what happens is that the right ventricle needs extra strength to pump the blood from the right ventricle. Thus it can cause right ventricular hypertrophy. So the next diagram is actually the level of the stenosis. It can happen below the valve at the right ventricle itself, which is called infundibular obstruction, infundibular stenosis, or it can happens at the level of the subvalvular stenosis, or at the valve, valvular stenosis, or above it, supravalvular stenosis. And it can also happen to the branch artery, and which is called branch stenosis. So the oxygen saturation is not really affected, but we can see the difference in the pressure, which is over the right ventricle, and the pressure at the level of the pulmonary artery. So so this is like the association. Williams syndrome can have pulmonary stenosis. Noonan can have actually valve dysplasia. There's a syndrome called Lappert that is consists of lentigines like skin pigmentation, ECG abnormality, ocular hyperthyroidism, pulmonary stenosis and retardation of growth, and deafness syndrome. Allergic syndrome, in which there will be valvular or branch stenosis, and also TOF. So coming to the pathophysiology, there will be right ventricular outflow obstruction, which will increase the right ventricular systolic pressure, and also causes the increase in the pulmonary artery pressure distal to the obstruction, and the pulmonary artery pressure distal to obstruction can either be normal or decrease. So the increase in right systolic pressure can cause increase in the wall stress, and which further cause the right ventricular hypertrophy. So without ASD or VSD, there will be no shunting of the blood from the right to left, so the arterial oxygen saturation remains normal, thus it is acyanotic. But in critical pulmonary stenosis, there will be severe, which is a severe pulmonary stenosis in neonate. There will be right to left shunt through the foramen, the pattern foramen ovale, which is which causes cyanosis.